Good evening, everyone. Welcome to the Gyan Pravah, a flow of knowledge, an unique initiative by our visionary leader, Dr. Sunita Tandurwadkar, President Foxy. Every day we come here at 8 p.m. sharp with the legendary guests on their respected fields. I am Dr. Sejal Naik, Chairperson Endoscopy Committee. Welcome you once again on every 8th of every month at 8 p.m. So before we begin this inspiring episode of Gyan Pravah, let us pause to celebrate the heartbeat of Foxy, a woman whose name has become a symbol of vision, vitality, and victory. She is not merely a leader, she is a movement of energy, empathy, and excellence. Our beloved President Foxy, Dr. Sunita Tandurwadkar. Dr. Sunita Tandurwadkar is a woman who lives every moment with passion, turns dream into direction, and transforms ideas into enduring impact. Under her dynamic leadership and the presidency, Foxy has entered an era of innovation and inclusivity where every project touches a different dimension of a woman's life. Sampurna Swasth Nari Abhiyan, Know Your Numbers, empowering women through the preventive health awareness, Do Tige Zindagi Ke, spreading the message of HPV vaccination and cervical cancer prevention, Anuban, between the emotional and professional bonds within the Foxy members, Eagle, soaring towards the academic excellence and leadership empowerment, Mukta, Adhuna, and what not. And her intellectual gift to the nation, Gyan Pravah. Now beyond 280 episodes, where knowledge flows, inspires, and transforms. Recent laureates, she was conferred with the prestigious honorary fellowship by the Royal College of Obstetricians and Gynecologists, London, an international recognition that celebrates her outstanding contribution to women's health and the field of obstetrics and the gynecology.
Sejal, I'm feeling awkward now. Enough. It is your day, Dipti ji. So thank you so much for your lovely word. And it is such a great honor, Dipti ji, that you came on a Foxy platform. Today, this triangle, I don't have a words to express. I never could have thought that this triangle will be. On one side, I have a daughter, Sejal, and I have daughter's mother, Pooja's mother. So Pooja always says she has three mothers. Yes. The mother, the biological mother, the academic mother, and the mother-in-law. Yes. So it is such a beautiful triangle, and I'm just taking for myself one photo to be clicked because I cannot leave this moment. I'm so glad, and it was such a great surprise. Usually, I know about every faculty. 7:30 p.m. I open up, I read about their biodata. Today was a very, very hectic day, and I just could not do that. And I got a surprise having Dipti ji. So, Sejal, thank you so much, darling. Thank you. And you know what, Dipti ji, this 8 p.m. joining, actually me, Pooja, Sejal and Ashwini together, last year during this time we were designing our, I think by this time we had finished designing our schedule of entire year, and Gyan Pravah was our one bold step where every night 8 p.m. But I have a 30 committee chairperson, and if I give 30 days to 30, so on 8th Sejal is coming, every month 8 she will be with one faculty. Believe me, I thought the chairperson will get the wings, they will get their own passion, decision, whom they should interview, what they should interview. It will develop or add on to their leadership quality, because these are my future presidents of Foxy. But more than them now, I got evolved. I joined 8 p.m. to show the respect that you have come on a Foxy platform. And then I just go to the viewers link and I listen to both of you. But I can interact with 280 plus faculty, and I have evolved. We all, obstetrician and gynecologist, we start feeling the endoscopy, ART or stem cell. This is our world. And we are doing out of the box and out of the world, and how achiever we are. When we meet these faculty, you realize there is so much more in this world in various fields, and we are just one tiny part in the ocean. There is many more leaders. There are many more things one can do. It opens your mind. It opens a different horizon to think over. And then you realize, ki, oh, you have a lot to achieve yet in life. So Gyan Pravah is one of my project which has helped me to evolve as a person. And my second project, which because of Sejal is going so beautifully, who is getting help by Subhash. I don't know how they both talk to, but I know whether Subhash joins or not, Sejal is working day in and out, is an Eagle project. Anywhere in the country I go, people talk about Eagle project with the medical colleges. There is so much demand, and we have crossed 150 Eagle projects already. It means every alternate day we are working in one of the medical college. So in fact, when I'm talking to you, I'm in the eastern part of India, reaching out to Agartala, Tripura, and reaching out to Shillong.
Shillong.
Yeah, so it's beautiful journey which we are traveling, we are doing. So I don't know how to express, but thank you, Foxy, for helping us to grow. And thank you, Diptiji, for taking out time to be on this platform. And I'm looking forward to have you next week in our Pravah Star Conference, Star Sampurna, because when it comes to thalassemia, we can't have the absence of Diptiji, who has worked so much in sickle cells and thalassemia, that the world should know. Thank you.
Thank you, madam. I would say, Sejal, you have talked about madam, and it's an outstanding tenure, madam. I don't think anyone else has done so much. Your wisdom and your vision and your dedication has enriched millions of people, let me tell you. And thank you, and keep growing, madam. And the blessings are always with you.
Thank you. Thank you. But I must say, every president has worked hard. The way they work is different. I like to touch to the Foxians, touch their heart, meet them. So
it's a unique way, but what I'm seeing is a unique way. Thank you.
Thank you. And I will join the link, Sejal, and have a great podcast and great dialogue. You got Diptiji 1 hour. Pooja, I'm jealous of you today. Pooja will feel jealous.
But many things for sickle cell and thalassemia. Okay, bye. See you.
Thank you. Thank you. Madam is our pulse of progress, the power of purpose, and the personification of passion. And because of Madam, what we are today. So thank you so much, Madam and the Foxy, for this wonderful platform. And we have today Dr. Deepti Jain, and I would like to take a few moments to introduce our today's guest. So today we bring you a story not only of science, but the service, compassion and commitment, a story of one woman's mission to confront the genetic challenges that continues to affect millions of lives in silence. It is my deep honor to introduce our guest, Dr. Deepti Jain, ma'am, a name synonymous with a relentless dedication to the cause of sickle cell disease in India and beyond. Dr. Deepti Jain is a distinguished pediatrician and academician, MD, MSc Medicine from Canada, and the former professor and head of the Department of Pediatric Government Medical College, Nagpur. She is also serves as an adjunct professor of pediatrics in SMHRC, Nagpur. Rockefeller Fellow, Dr. Deepti Jain work bridges silence, social impact, and policy. She currently chairs the Government of India Task Force towards the elimination of sickle cell anemia in India by 2047, a national mission that envisions the future free of this devastating disease. Her contribution extends globally. She is the co-editor of Lancet Hematology Commissions on Sickle Cell Disease 2023 and an advisor of Global Network on Sickle Cell Disease. Her extraordinary journey and leadership were recently recognized as the world stage when she received the Ham Weizmann Oration Award from the American Society of Hematology in 2024, a rare and prestigious international honor. But beyond the awards and accolades, Dr. Dipti Jain is a healer with heart who has transformed awareness into action and research into the real hope for thousands of families living with the sickle cell disease. Her mission embodies the true spirit of Gyan Pravah, when knowledge flows with purpose, compassion, and the power to change the lives. With immense respect and admiration, let us welcome our visionary, the reformer, the relentless advocate for the healthier India, Dr. Dipti Jain, ma'am. Thank you so much for sparing your time for this valuable platform, and we are really highly obliged to have you. Welcome, madam.
Dr. Sejal, you are a wonderful person, a calm, meticulous, and
Thank you.
very popular amongst the patients, and committed for the holistic approach. Thank you, Sejal, for
Yeah.
having me
So,
here. Yes.
being a gynecologist and obstetrician, we do feel we have some responsibility towards prevention and the elimination of such a disease. So, madam, you have devoted your decades of life in this cause of for the sickle cell disease. So, what first drew you to this field? How did this your journey evolve from a medical college, like medical education, into this lifelong mission?
It's a story, Sejal. I passed out from Medical College, Nagpur, Government College, Nagpur. And during that time, we did not have pediatrics as a separate subject. So we did not see many sickle patients, and I had not heard about sickle cell disease till I entered the pediatric ward. I'd heard about thalassemia, but not sickle cell disease. Exactly, it was 1st February 1981, my first day of registrarship. That day when we got MD, we were called registrars in pediatrics. So I remember entering Ward 9 and the in-charge sister Isaac running to me. She didn't know my name. Doctor, come to the emergency room. There's a serious patient. She needs resuscitation. I didn't know how to give resuscitation at that time. It was Isaac's sister who taught me how to give cardiac massage. In those days, we used to give intracardiac adrenaline and everything. She helped me to do that. Now, that girl was 36 months old, Kirti. I remember her name also. She was pale. We could not survive that child. But the patient was admitted 30 minutes ago, and sisters had just taken sample for blood grouping and cross-matching because she was very pale. That's all I had. We knew that she had received one transfusion in the past at the age of 2 years. And my curiosity was, what was the cause of death? Now, nobody knew. The family was not knowing. Nobody knew. They said, oh, blood mila tha ek baar, and we don't know. Coming with 2 grams of hemoglobin. So the only thing I had in my hand was a blood which was collected in heparin those days. So we made a peripheral smear with the help of my seniors and found, they said, there are some sickle cells. And the way we used to detect sickle in those days were doing a sodium metabisulfite slide test. Just put that and put a slip and see if there are sickle cells, right? And in this child, they were there. So after that, as I entered the ward, around 25% of my patients were always having sickle cell disease. And the children were always crying with pain. And when I would ask my seniors, what is this? Why do we have this? Oh, they are sickle cell. We can't do much about it. We can't do much about it. They will cry, they will have pain. You give them blood and that would be fine. But I was not satisfied with that. I went further. I could do that only after I passed my MD. Till then I was a resident. After I passed MD, I became a faculty in that department. And I said, I want to start a small clinic for these patients of sickle cell disease. And this clinic was very basic. I had ORS packet, folic acid, and if you remember, Sahali's hemoglobinometer. You all must not have even seen that. A very
We have
simple,
seen.
yeah.
Yeah.
So with which we could do hemo. So I collected those patients and I told them I can give you from my salary, only 100 rupees will give me 1000 folic acid tablet. So I can give them for 15 days. So they don't have to come every 3 days. So they started coming to me. And thanks to my professor, my in charge, who allowed me to do that. Yeah, that's also important. Dr. Dani was my professor and she allowed me to do that. And slowly it started from 5 patients to now we have thousands of them, right? Every year we have 1000 new patients. But what was I giving them? Nothing. ORS, folic acid, and doing hemoglobin. Slowly, after 3 years, I got an opportunity. I was selected for Rockefeller Fellowship. I think it was time for me to learn and retool. So there I did my master's in research methodology. And apart from that, what I did not go for that, but I saw patients of sickle cell disease. There was a legislature in US. All patients of sickle cell disease, they are screened at newborn and they will get penicillin and hydroxyurea. I was not aware of anything about sickle cell disease. So on my return to India after 16 months, I think Rockefeller Fellowship I could do because of my family, my husband, who allowed me to go, my 2 children, Pooja was 7 and my son was 4. And he took care of them and I was there for 16 months. I completed my master's in this. And because it was a very prestigious fellowship in those days, Rockefeller Fellowship. So when I returned, I said, what can I do? What do I have? The only thing I had was injection Penidura. In those days, many rheumatic patients, rheumatic heart disease, for them we had Penidura. So it was a long-acting penicillin. So instead of giving everyday tablet penicillin, I would admit them and give them every 3 weeks. So that is how I started with penicillin. And I got confidence. More patients came in and people also started supporting me. The other thing which I had seen was hydroxyurea. It's a drug for sickle cell disease, a magic drug. Once you give the patient hydroxyurea, their quality of life, and there's so much improvement in them. But then how do I give that to my patients? Those days, my patients, my understanding was very different. The sickle cell do not survive beyond 10 years, 1 decade. I had not seen children about 10 years. So my understanding was what is with many today also, which is not true, right? So hydroxyurea, 1 tablet was 56 rupees per day. You have to give every day, every day. I got a philanthropist. He had come to my ward to see a Gulanbari patient, but then he said he saw this work and he said, I can sponsor 30 patients, 30 for 2 years. Okay. So I was happy. Let me start with that. So I did an RCT where to give it to my student, MD student, and we had 30 control and 30 with hydroxy. It has immense effect on the patient. Very good. After 2 years, no funds, so no hydroxyurea. So the patients could not afford. Sickle cell patients cannot afford. They couldn't afford folic acid, leave apart hydroxyurea. One of my patients, Harshu, his father was an engineer. He came to me, he was an engineer in WCL. Dr. Jain, what is this? What have you done? You've started something, my patient improved, and again he's back to pain and everything. We can't afford that. I will try. I'm an engineer. What about other patients? How can you do such thing with patients? So he started a movement. The message I want to tell you is this is not me. It is the patient's father who got all relatives together and started fighting with the government. That this should come under government and we should get free. In 2006, Maharashtra was the first state where there was a GR that all medicine for sickle cell disease will be free, testing will be free. So it was just one patient's father's movement which made this possible. Of course, I always supported them, I helped them, how can they go forward, but then it was him. Then there were many things, such steps which came, and once Maharashtra got this, Chhattisgarh started, Madhya Pradesh started, Kerala started, Gujarat. Then came a project called Gyan project. It was an ICMR project, a first epidemiological study about sickle cell disease in 8 primitive tribals of India. And I got to work in Bhamragarh, which was the base for Babam. I got an opportunity to work with Babam for 6 years, Prakash Bhau and Mandakini. We were based in their setup. Very simple, under a tree, the patients would be seen, and very simple those days. Now things have changed, but we have stayed there for 6 years. My team was there. So that was an eye-opening for us, that tribal, we can work, and they are much better people for compliance if we explain them and we do it in the right way. We involve the local people in their language, they explained, and very good. And this was Deepika Mohanty, who was one of the directors of ICMR Mumbai, NIH now, who had started this project. One important thing which we got during that, Gujarat was one of the sites for this project. And that time, our Honorable Prime Minister, Narendra Modi, was the Chief Minister of Gujarat. He had come to one of our meetings, and since then, he had understood sickle cell, which he continued. And if you remember, after he became Prime Minister, he went to Japan, and somebody told him about stem cell transplant. And he said, will it be useful for my sickle cell patients? Imagine, that went that long, what we had done as a field study. And from down this small story where I did not have anything to detect sickle cell, we got different states involved. We were all working in pilot, regional work. We got to coordinated and then the mission. So this is in short how we have got prenatal diagnosis in 2006 and now bone marrow transplant and gene therapy, everything. So this is in short how I got into sickle cell, and there were challenges and there were achievements which continued one after the other.
So just one flame of one initiation of giving something to the helping the patients had created the big fire across the country slowly. But that was all the randomly done projects and the, as you said, the pilot project at different state. So how it has got the collaborated together, and now it is like it is a task force mission. It's a very ambitious national mission towards the elimination of sickle cell anemia towards 2047. So what are the key pillars behind this mission?
It was one of these, of course, the Honorable Prime Minister, he had sickle in his mind. The other thing, there was a study from our tribal population. And he always wanted to do for tribal people. But one thing I want to make sure that there is a myth that sickle is seen only in tribals. Not true. It is equally seen in non-tribals. But then what Prime Minister is aiming at is to reach the tribal. That was his aim. And he wanted to look at diseases which are more prevalent in tribal population. His focus was on tribal population, and in tribals, sickle, malnutrition, and other diseases. That is how he focused. In a pilot, he saw there were so many sickle patients in tribal area, and that's how it was a surprise even for me when it was declared. And the word, let me tell you, correct here, eliminate or eradicate sickle cell cannot be done. Yes, we cannot use that word. That was used and we cannot change. It means prevent birth of a diseased sickle child by 2047. Yes, we cannot eliminate.
So you have been working for decades together on this sickle cell, this mission. So what are the barriers you might have come across, like any medical, social, like infrastructural barriers? So if you can enumerate few of them.
Yeah, of course there were barriers. Yes, but then what I have learned is do the best with whatever you have. Don't stop. Right? Don't stop wherever. Do with whatever you have. मेरे पास ये नहीं है, machine नहीं है, HPLC, इसलिए I will not do more. I was very lucky to have good collaboration. First time I presented a paper, I was invited at Ghana Global Sickle Cell Meeting. That was the first one. And nobody was talking about India that India has sickle cell disease. Though it is first sickle patient was seen in 1952 in the tribals of tea gardens of South India. But India was not on the sickle map globally. So I was the only Indian in that conference. And when I talked about my patient's severity, it was like, what is this girl talking about? Sickle cell in India, they are severe, there are patients, some problem. Because I did not have the molecular test diagnosis of my patient, right? You have to be, I've learned many things from my Rock Fellowship that you should have scientific evidence properly. Then I got in touch with Mumbai and I had patients. The patients of sickle cell are concentrated in central India, Gujarat, and not in Delhi, Mumbai. We have referral patients there. But what we see here are very different from metros. So they did not have patients, I had patients. So we had collaboration with NIH, and all my lab work, the best of lab work in India on hemoglobinopathy is with NIH Mumbai. So they did my lab work, I had my clinical phenotype. It was a very good combination, and that's how I could publish so many papers after 2008. You need evidence. You just can't say India is this, India is that. You need evidence with good methods and tests. And that's how I could come across that. Otherwise, people were not ready. And we had many, we could not extrapolate whatever is available in Western literature about African sickle cell. It has originated in African. I cannot extrapolate to my patients. I have learned that now. We are different. We learned that our haplotype, that is at molecular level, sickle cell is different in India. So we cannot copy whatever others are doing. We need to have our own protocols, own things. So we have adapted many things for treatment, for newborn screening. So now, initially they were asked questions, but today they have been accepted. And today I'm one of the CDC member for Africa Sickle Cell Mission, which they are going to start. That how did you do this? So I mean, we have to adapt. We can't copy what US is doing or Europe is doing. I had my own thing, which are now extrapolated. But it took a while with good evidence. Of course, the other barrier, which I never thought, we are just busy managing pain, blood and all that. Stigma. Very important. Stigma is very important. हम पहले colored card देते थे. Blue means carrier, pink means disease, and white means normal. That created so much stigma. We stopped. So for elimination, we have learned many lessons, which we are. So there are many barriers, infrastructure, training, many things. But the most difficult, I think, is to educate our health professionals. Still, we need to have many more awareness and education things for our health professionals, health workers. But things have definitely changed after elimination.
Yes, today even still not a like preconceptional care, what Sampurna is coming with the Foxy project, where preconceptionally you should check, or actually premaritally you should check for the trait and the disease, so that we can prevent, as you said, we prevent the birth of the sickle cell disease.
So I forgot. The biggest problem is traits are normal. They look normal, right? So when we go to the community and tell them that get tested, why should we? Hum kyun karenge? For generations, nobody has suffered in my family. So, you know, the awareness and education has to be very precise and specific. Very specific. I've learned many things. You break many marriages by doing wrong awareness and counseling. You should know. What I have learned the most now is what not to say.
Not to. Correct. What not to say.
Yeah, what not to say. Yeah, while counseling and what message you need to give. So we have learned with patience.
Experience and time. What a wise advice, madam. You being a wonderful clinician, you have worked with a very limited resources to the latest, whatever the advances available. You are also a very good academician. You have been awarded for these, your research and papers and your, these all are like awards from the American Society of Hematology. So these awards, and the global recognition, what does they actually mean to you, madam?
It means it is really, I'm honored to have that, but it is not me. It's my patients, let me. Their unconditional faith in me, Sejal, you won't believe, they are like my family. For years together, they have been with me. Now my Harshal, the fathers who brought all these changes and many more things which he has got for sickle patients. He's now 48 years old. He's in US. He takes part in a car race. Yes. So it's so satisfying. It's my team. It's not recognition of, and it's the recognition of the work done in India. India has become a global leader. Imagine in 2005, they said India में sickle है, severe है. And now India is leading. It's a model. Nowhere in the world treatment is given free for sickle cell. Everywhere they have to pay. For India, everything is free in public sector for sickle cell disease.
So that's the greatest moment, and the what you said is the immense satisfaction,
Yes.
which we may not get with any awards, any
award.
amount of payrolls or nothing. So nice to I'm carried away with your emotional journey as well. So, ma'am, many families, they silently bear this social and emotional burden of this disease. Could you share any one experience apart from this Harshul's
Yes,
case
Sejal.
that
See,
has deeply touched you?
exactly. Let me tell you. Still, मुझे लगता है ये क्या award recognition मिल रहा है. Still, my patients are suffering. है ना? I'm not got rid of that suffering. इतना पेन होता है कभी कभी कि मेरे को भी उनके सामने ही रोना आ जाता है. I can't keep quiet. Okay, but then what can we do? What can we do? I think I would like to tell one success story which should be extrapolated everywhere. One Aji. Aji means grandmother. Okay, in a Aheri, it's a Gadchiroli tribal village. Okay, I'm going to tell you that. She came to me ki, why are you taking blood of this patient, my village people? Right? People used to respect her, call her Ai. Ai means mother. So
Mother.
I said, everybody sagra normal Ai. Why are you doing this? Why are you taking blood? What are you going to do? You are selling this. Something, all she said. I said, I'll explain you. It took 3 weeks for me to explain her slowly. Why am I doing? Why they are normal? We are preventing sickle cell disease in next generation. Not now. Okay. So she said, I said, prevent marriage between carrier. Explained her what is a carrier. You look normal, but a carrier should not, don't use the should not. Avoid marrying a carrier. If they marry, these are the chances the child would be SS. I showed her one SS child. What was happening? She said, don't you have children? I said, I have. So, बोले कोई लड़का देखने आएगा तुम्हारी लड़की को. Will you tell your daughter has AS? Will you tell him? If she has, will you tell she is a carrier? तुम खूब ऊपर बातें करते हो. You will never do this in your family. And she was right. She was right. My doctor students who are AS, they never tell if somebody is coming to see that they are AS. They never tell. Worked with me. So it is hypothetical, theoretical, or it will take some time, decades, to say that pre-marriage counseling for sickle cell, avoid marriage. मेरे वहाँ कॉलेज के बच्चे आते. IMAS, my girlfriend is. क्या हम शादी नहीं करेंगे? मैंने बोला करो, but prenatal diagnosis करो, pregnancy के बाद. That is the message. So this is what I told Aji. That आप इतना काम करो, शादी मत करो, मत बोलो, test, but at least during pregnancy, early pregnancy, not after 3 months, get all pregnant women in your area tested for sickle. And सिर्फ वो करके बंद मत रहो. Test the husband immediately. Only if the husband is also positive, we need to do prenatal. She is doing, and I got so many patients from her. She's spreading that message. And I think it's a movement, woman there, which has started, and many people are looking to it. So I think that is one thing which I would say. And I think we have prevented many SS births with that eye who is working on it.
So once she convinced herself
Yes.
with your arguments or whatever explanation, now she is the torchbearer further.
Yes. Yes.
Wonderful.
So this has
So
to be with all Foxy, all members, definitely.
yes.
Because in the first phase of elimination, we have done awareness, education, screening, treatment, everything. But prenatal diagnosis, antenatal screening should start soon in 2026. And all pregnant women, as early as within first trimester, should be screened for thalassemia and sickle cell disease. Yes.
So, ma'am, you are a mentor, a teacher. So, how do you inspire your young doctors, the Gen Z coming up with the lot many fixed ideas and so how your journey, because they may not believe this long decades of hard work and so for this, especially considering the social services or responsibility towards our society.
I think it is tough job, definitely, with today's type of students who are coming. But then I was lucky to have many students. I told them we have to go out of textbook. And treating is not healing. You have to see the patient as a whole. Treatment they karo. And they have seen me. And when you are a head of the Department of Pediatrics for many years, they sometimes have to do, right? And by doing that, they get into it. They get it. You help them in their publication, their name, tell them paper. I send them to ASH, everything. So I think that's some incentives you have to give, and they get into. And most of my students go for hematology and are working on sickle cell disease. I'm happy to say that.
Yeah. So, and as a social service, that may not fall into our defined job. Being a head of the Department of Pediatrics, you don't have inclined to do the social services and go and do So, I would like to know how this seed come up inside you.
What they have seen me is, I see GMC Pediatrics is very busy. So sickle cell is a very small thing which nobody wants to look at. Let me tell you, because there are so many other things which they have to do and they are interested in. But I used to work after 5 o'clock, after my office hours, 5 to 7. I never went home before 7. 5 to 7, my sickle time. Okay. It was not a part of our duty, and no vacation. Vacations, Dipti Jain works on her sickle data, publications, whatever. So they have seen me working, and you cannot force them. But then, they also, when somebody is doing so much, some of them, and so many international visitors, they come to Nagpur. I don't know them. They just call and they say, want to see sickle. The first sickle cell clinic was started in Nagpur in 83, which I said, a small clinic. So they come and see my clinic, how I treat things. So they are seeing all that. So they get exposed. Nagpur is a small city, we rarely used to get visitors from abroad in our college. So they were really fascinated by those things also. And of course, the quality of life, the patients who do well, it's so satisfying. They feel good. And thesis. Really? Most of them had thesis on sickle cell disease. Patients were always available, so they had no problem about patients. Investigations were always done. So it was a very easy thesis topic. And when you do thesis on one topic for 2-3 years.
Ma'am, your journey is like अगर आप शिद्दत से कुछ चाहो तो पूरी कायनात आप उसको मिलाने की कोशिश में लग जाती है. वैसे you started with this full faith and the determination, and the slow and steadily everyone joined the caravan, and it is really amazing talking to you. Very inspirational. There is a little bit time we still have. Can we have some rapid fire questions, just 1 or 2 line answers?
Sure.
Surprise, madam. So, ma'am, for you, research or field work, what excites you more?
They go
Your
hand in
research.
hand, but my field work is definitely, I'll prefer field work.
So, your proudest professional moment. So many, maybe you can.
Many. When my see, many patients from bone marrow transplant is the ultimate treatment. All do not require. Out of 100, 3, 4 require. So for years I'm aiming. I've got everything till hydroxyurea, but no bone marrow transplant in my place. My patients cannot afford. There are 492 bone marrow transplant done in India for sickle cell, but all from African, not Indians. So 2 years back, one of my patients got cured of bone marrow transplant, Aryan, and his father is a professor in IIT Powai. So they could go and do that, and he's cured of sickle cell disease. Cured of sickle cell disease.
That is
So that
freedom.
was really, there were ups and downs and many admissions and infections, everything. But now he's cured.
You are the true doctor. You don't want your patient, you want patient to free out of you. You don't want them to come to you again.
No.
So, as we discuss about this stigma, so what is the one misconception about the sickle cell disease? You wish we could vanish it overnight. Any misconception that is in general population?
Yes, there are 3 or 4, at least in my area, that it's a curse. The family should not feel that. No, it's not a curse. Because our grandparents ate cow meat, so we are suffering from sickle cell disease. And other thing is, we are different. Sickle cell patients, they feel we are different in schools. In school, you know, we just do not look at the patient as a whole. I just used to see pain है गोली लो, पानी पियो, बहुत पानी पियो. फिर एक पेशेंट मुझे डांटा, काय बोलते रहते हो पानी पियो पानी पियो. पानी पी के स्कूल में जब हम वॉशरूम जाते हैं, टीचर कितना डांटती है. स्कूल में ये सब बच्चे लोग को डिस्टर्ब कर रहे हो, तुमको पढ़ाई नहीं करना है. They leave school. They leave school. And one thing, that sickle cell disease do not live a normal life. They do today what I thought in 80s. They do live a near normal quality life with like blood pressure, like diabetes, hypertension, like diabetes. That is one myth everybody has. And let me tell you. So my Harshu is in US 48 years and he's taking part in car race, and many doctors, many IIT scholars. So we have people everywhere. So that myth I would like.
That's really a hopeful myth.
Yeah, hopeful myth. Yeah.
So, ma'am, if you are not a doctor, what would you have been? An activist, a social service.
Social service would always go with doctor. Social service is always there. Always wanted to do social work. Definitely. But something to do with children. I would have done something to do with kids.
Yeah, near or around the kids.
Ethics, yeah.
So, one advice or one habit that every young doctor should have cultivate in their life. Any young doctor should have this habit. So, what you would advise?
I would advise to have, apart from your academic professional knowledge, we have good human values. Good human values. Speak well, speak as a whole with them, spend some time with the patients, the relatives. I think communication is important, and care for the patients. Just don't treat them with medicines.
So
Go
true
beyond
from heart,
medicine.
ma'am.
Go beyond medicine.
Yeah, directly from heart, yeah. So, ma'am, you might also have seen many setbacks, some of your patient dying. And what is your mantra of staying hopeful even in such a challenging situation?
I've seen people growing, children growing, right, from 80s. Now my children are in late 40s. Yeah. So my hope is things are improving in India. The mission which has come, there are rare facilities, mission for any diseases in India. Very few have polio, tuberculosis, but sickle has been recognized as a priority thing. The politicians are priority disease. They are making facilities. They have put one hope. They continue, right? The doctors are becoming aware, though we need much more. And the patients are also changing. They are also operating. So I think at all three levels, I have hope.
So we do all. Ma'am, thank you so much. And the last question I would like to ask you, in one word or a few, 2, 3 words, that if you want to define your entire journey so far, in a short, you would, if I want to write a book on you, so what would be the title of it?
I don't know. I just don't know. I never think about it. I've taken things as they have come, even in sickle cell. I took opportunities. I faced many challenges. But then my friends tell me, global friends, Dipti, you are the winner. With all the challenges you are facing, you come over it. And I think we can all, with some hardship, there are solutions everywhere. And my journey has been hardship and rewarding, definitely more than what I deserve. And my passion, my patience, nothing else. My patience are everything. Everything.
Oh, ma'am, it is really a heart-touching and from heart to heart conversation, and really I thoroughly enjoyed it. It's very inspirational, and I'm starting, like, changing the view pattern from treating to healing. And thank you so much,
There's
madam,
one
for your
thing, gene therapy is coming. Gene therapy is available in US and UK. In India, it will be soon available, will be cheaper. It should be affordable, right? It will be available, but it should be affordable. So that is what we have a really good breakthrough, and we will soon be having gene therapy for sickle cell.
oh, so that's a really
that's
amazing
another
good news.
promising.
That can be along with sickle cell, many other diseases can also
Right.
be
Thalassemia, sickle cell. Hemophilia already has in India sickle cell and thalassemia.
wow. Looking forward to it,
Yeah,
and we'll
sure.
have again
Yeah.
the second podcast with you with that super
Sure, Sejal,
success
I
of
love to
gene
do that.
therapy.
You've been very kind and loving. Thank you so much, Sejal.
Thank you, ma'am. Thank you
Thank you.
for your time and wisest advice, what we can have with such experienced senior and dedicated person ever in this platform, madam. Thank you so much. And
It's the
I
team,
also
Sejal, not me. It's the team which has worked, not me. Yes, all this goes to the team. Though I am sitting here in front of you, there are many who are not seen. Yes.
I do
We
understand,
thank
and
them
we are
all.
also taking a baby steps towards the leadership. So we do understand we are nothing without our team.
Yeah, team.
Correct.
Okay.
So thank you so much, ma'am, and thank you, Sunita, ma'am, the Foxy, for this giving us such a wonderful platform to interact and to understand the minute details of the disease and the awareness program, along with the dedication and the entire journey, hardship, challenges, and whatnot. So thank you, Evangel team, technical team, for supporting this, and thank you. Have a good night, and wish you all. We'll keep on watching this podcast again. We'll share you the link soon, ma'am.
Thank you.
Thank you.
so much.